Hello, good morning to everyone. So Mirza Adil Beg once again. so a lot of us has been given exam for UGCNET, and as we are coming from the background of Master of Public Health, so we are having one subject is specific for us: social medicine and community health. Sorry. So once we will go through that syllabus, then there is one of the specific chapter in the syllabus, very important part that once I have given that the exam, so there is a coverage from this chapter. So if you will go through that previous year papers, so you will come to know about this. So I have given this exam for thrice, and unfortunately at all the times I not succeeded to pass that exam, either for JRF or assistant professor. So by this time I am preparing once again. So rather than passing itself myself, so I am preparing this for you as well. So it's a night of 2:23 a.m. it's ongoing. So let's start and have a coverage on this. Likewise, in the syllabus, there is directly history for social medicine and community health. Epidemiology is over there, history of public health and its milestones, comprehensive health care, social, a lot of things is over there. So once you will go through that, you will come to know about this, how this much is important for it. So once you will start with the chapter of epidemiology, clearly saying means that epidemiology, I keep six honest serving men. They taught me all. I know their name are what, why, when, how, where, and who. So let's start from this. So basically, introduction to the epidemiology is that there is a lot of definition has been given. So refining to it, it comes to it's a basic science of preventive and social medicine. The definition goes to a study of the occurrence and distribution of health-related events, states, and process in a specified population, including the study of determinants influencing such processes and the application of this knowledge to control relevant health problems. So basically, is this epidemiology involves study of surveillance, observation, analytical research, experiment, and prediction. Distribution, in this distribution also a part. So distribution refer to analysis specified by time, place, and population, like with geography, which we are defining over here. Either it will be regional level, country level, specific to your state, or like with district, or global scale also. So, determinant are the geophysical, biological, behavioral, social, economical, which influences health. And health-related events, likewise, our most recent, which has been outbreak in all over the world, that is COVID-1. So, causes of deaths, behavior, environmental. So, these all processes involved over here. So the ultimate aim of epidemiology is to lead effective action to eliminate or reduce the health problem or its consequences, also to promote the health and well-being of society as a whole. So aim of epidemiology as per IEA, likewise the International Epidemiological Association. So it describes health, disease distribution, identify etiological factor, provide data for planning and evaluation. So going deeper into this, we will come to know distribution and magnitude of health and disease problem in human population. So basically it is to identify a risk factor in pathogenesis of diseases, also to provide an essential data which support in planning, implementation, and evaluation. Based on this, a briefing of policies and suggestions will be made like basically for the treatment of disease and setting the priorities as well. And it describes on the behalf of studies, explores disease frequency. Analytical studies investigate determinant and risk factor, like basically what is the risk factor specific for that disease. Like in case of maternal health, we are identifying that risk factor for high risk pregnancies, like with short stature, if she is having previously LSAS, cesarean section. Apart from this, if she is severely anemic, so that all these determinants is coming for this high risk. Experimental and interventional studies evaluate the health program and interventions. We will discuss it deeply in the next slide. Ultimate goal: effective action to eliminate or reduce health problem and promote well-being. So this is the aim of epidemiology. So epidemiology versus clinical medicine. So unit of study for epidemiology is in defined population, while in clinical medicine it's directly a case or cases, like this directly patient is coming for the treatment, while in the case of epidemiology we are itself finding out that the reason. So in epidemiology it will be a defined population or population at risk. So, in clinical medicine, physician is concerned with disease in the individual patients, whereas epidemiologist is concerned for the disease pattern in entire population. That comes under part of epidemiology. Uh, sorry, epidemiology is directly concerned with the both, that is sick or as well as healthy. While in the case of clinical, it's come for only for the sick patient or the cases who are directly coming for the treatment. So, epidemiology focus on disease pattern in entire population, geographical population, while clinical medicine specifically focus on disease in individual patient. Relationship both closely related to coexistent and mutually helpful to each other. Interdependence, clinical and epidemiologists collaborate for comprehensive understanding. In clinical medicine, like basically we directly we know about that key patient come to the doctor, while in category of epidemiology, investigator goes out into the community to find person who have the disease or experience of suspected casual factor in this. While epidemiological approach, we can say that key foundation based on asking question and making comparison. So in this, based on asking questions, like basically question asking question will be about health events, actions, preventions, and challenges. Uh, while making comparison between groups, individual or population draws influences for etiology. Need for comparability is also the similarity between both of the groups for meaningful comparison. So question related to the health event, like basically what is the event, like basically what is the problem while we are going through the COVID wala part. So if you are not able to smell, and that all the part over there. So what is the magnitude of that, what is the like basically pulse oximeter we are using for that. And apart from this, various question to identify this magnitude: where did it happen, uh, when did it happen, like basically who are affected, if only one person is affected or whole family is affected. And apart from this, Why did it happen? We can ask on that. On the other hand, related to the health action, what can be done to reduce this problem and its consequences, and how it can be prevented in the future perspective as well. What actions should be taken by the community? So, if we can take the example of tuberculosis, in this, how it can be prevented in the future, we are working on that. So real-time identification is over there, notification is over there, is studying the treatment specific for the patient, and also preventive therapy for household of that index patient is also over there. What actions should be taken by the community in the community if that close contact is coming in this? So they we will be going to provide them preventive therapy, so that is not going to be developed in that contact of that person. So this by this we can reduce its the next question we can ask, by the health services, by other sectors, by the health services, like basically if treatment is initiated on the time, medication of tuberculosis, if symptom like basically based on ATD or MDR TB, uh, where and from these activities are carried out. So activities can be carried out at all the three levels, like basically UPSCs, PHC, CSC, root sites. Apart from this, if severe MDR is over there, so we are having nodal DRTB sectors in all over the health sites, so that can be taken on that. So specifically, by making comparison between the groups, the epidemiologist tries to find out that crucial differences in the host and environment factor uh, between those affected and not affected. If we can say that like basically Mumbai overburdened area, like basically in the very small geography, a lot of population is over there. So while in the comparison of other side of Mumbai, so where population size is higher, so might be chance of tuberculosis will be over there high. If so, on this background, epidemiologist tries to find out that connection uh, uh, in between host and environment factor. So measurement of epidemiology. So scope is broad and unlimited. It measurement under measurement it covers mortality, morbidity, disability, natality, attributes of disease, medical needs, environmental factor, and demographic variable. So uh, basic measurement in epidemiology comes variate like basically any piece of information about the patient and disease. Other part like we see discrete variate, continuous variate is also over there. So circumstances is also over there. In the circumstances, factor in under the circumstances, factor is the environmental suspected of causative agent, like with air pollution, like in the air by the aerosol, tuberculosis is going to be communicated from one person to another. Component of well-being need to be better identification and measurement of psychosocial aspect as well. So requirement for this is validity, reliability, accuracy, sensitivity, and specificity. Challenges, measurement error are unavoidable. Focus on reducing error through quality control. So so in this measurement, we measure mortality, like basically directly related to death in the population, number of deaths by tuberculosis, And morbidity, like basically it measures the health condition if anything is happening over there, like basically loss of eyesight. So these will come over here. Disability is also in the same part, interconnected over here. Measurement of impairment in functioning. Natality measures birth rate in population. Apart from this, environmental factor contributing to disease causation. Demographic, as I have said, in Mumbai, overcrowded area and less crowded area. Apart from this, population characteristic is also over there. Age and sex will be there. So, specifically, if we are facing the challenges in measurement, psychosocial aspect, as we have discussed, area not fully covered, require better identification and measurement. So, basic requirement of measurement in the first, which we have discussed, that validity, reliability, accuracy, sensitivity, and specificity. Need for standardization, international comparison challenging due to difference in terminology. Continuous evaluation. Focus on refining and expanding measurement of methodologies, which we will cover in the next chapter. So, tools for measurement in epidemiology. So, it comes for the three tools: rate, ratio, and proportion. So, I remember that I was giving one of the interview for state position at Lucknow. So, that interviewer has directly asked me the difference between rate and ratio. So these things is like basically very minute things, but at a very some of the exams and in the interviews, even if you are going to give the exam for NHSRC or Ministry of Health and Family Welfare, so these questions might be over there. So rate directly express disease magnitude as a rate, like basically a rate ratio or proportion. So in this we can take example death rate per thousand population, or as per IPHS standard guideline by NHSRC. So there is a specific number has been given for doctor population ratio. So that can be also be taken over here. So, generally, rate measures the occurrence of some particular event, development of disease or occurrence of death, number of deaths in 1 year. That's come for the number death rate. So, in this, we will multiply by 1,000, and denominator we will take that mid-year population. So in this, like basically in the rate, we take the elements numerator, denominator, and time specification, that is mid-year population, as well as multiplier by 1,000. We will take over there. On the other hand, ratio expresses a relation in size between two random quantities. So this is the example has been taken for our red blood cell. So as the ratio measures disease frequency, so the number of children with scabies at a certain time divided by the number of children with malnutrition at the certain time. So in this, the difference between this is the numerator is not a component of denominator in the ratio, while on the other hand, proportion, ratio of indicating the relation in magnitude of part of the whole, often expressed as percentage. So proportion is ratio, which that in this the numerator is always included in the denominator. So this is the difference. A proportion is usually expressed as a percent in the form of percentage. We can take in this key the number of children. We can take in this key the number of children with scabies at a certain time, and the same divided by the total number of children at the village at the same time, and multiplier we will take over here as 100. So numerator and denominator concept in this numerator, number of time at event occurs in a specified time. So numerator likewise, births, defects, episode of sickness we can take, has occurred in population during a specified time period. The numerator is component of the denominator in calculating rate, but it is not in ratio as we have taken in the previous slide. Denominator lower portion of ratio. So here in denominator, lower portion of ratio, population related to the event related. So mid-year, because of population size challenges, changes daily due to birth date and migration as well. Likewise in the I belong from Uttar Pradesh, and right now I'm in Uttar Pradesh, but previously I was in Delhi. So likewise me, a lot of people migrate from Uttar Pradesh into Delhi, Mumbai. So so that's why we are in this we will be taking mid-year population. So mid-year population will be taken, and denominator types like is ki mid-year population based, and population at risk. Population at risk we can take in this background ki uh, if we can take a rate of accident for a town, so the population at a risk is the all the population residing in that specified population, so that all people is on the risk. Based on person time is also over there in the cohort. So mortality measures like basically crude death rate, and number of deaths from all the causes per thousand estimated per year population in 1 year. So that come for this crude death. While on the case fatality ratio, so this one is crude death rate is calculated over there. Now on the other hand, when we are going for CFR, then it's called for ratio. The ratio of death of cause of a specific disease, and for this formula will be total number of death due to a particular disease, or we can take a tuberculosis. So total number of death due to tuberculosis, total number of case due to the same disease, multiplier we will take 100. So the usefulness for this, its CFR case fatality rate shows that key directly the killing power of disease, while a measurement of morbidity, any departure subjective or objective from a state of physiological well-being. So, equivalent in term like sickness, illness and disabilities. So as per WHO expert committee on health statistics, so they have measured term in 3 unit. So unit of measurement, person who were ill, illness, period of spell of illness, and the third goes to duration, days or week of illness. So in the same context, as we are discussing, so aspect of morbidity measured, aspect is likewise ki frequency, duration, severity. So disease frequency is measured by incidence and prevalence rate. On this, the average duration per case of disability rate, or the disability rate, which is the average number of days of disability per person, may serve as measure of duration of illness. On the other hand, the third one, that is severity. CFR, as we have discussed in the previous slide, case fatality rate or ratio. So that may be used as index of the severity. while commonly measured by morbidity rate and morbidity ratio. So morbidity data can be taken in two parts. It describes the nature of disease load in community as well as establishment priorities, and it usually provide more comprehensive and accurate and clinically relevant information on patient characteristic that can be obtained from mortality data, and it also serves as a starting point for etiological studies. This also help in monitoring and evaluation of disease control activities. So incidence rate can be defined as the number of new cases occurring in a defined population during a specified period. So if likewise 500 new cases of tuberculosis is coming in a population of 30,000, if we are taking any block, so we can calculate the incidence on this, and incidence rate must include the unit of time. So unit of time is very must to use in the final of expression. It will be seen from the likewise key definition as well. Likewise incidence is only for it calculate for it can be taken only for a new case. While going through the formula, you can also see that key is during a specified or given time period will be there. Usually 1 year can be taken. Specified population can be taken like basically population risk unless other denominator is chosen. It also provides a data of episode of sickness, like basically if we are taking uh, a time spell of cough and or fever or anything else. So if a person is got affected by twice or for that specific disease in a year, so it can be counted as two spell of sickness. So behind incidence, so prevalence is also a part over here. So prevalence can be defined as number of all current cases, that is old and new. That is the difference from incidence and prevalence at a specified disease at a given point in a time. Formula in this there is two more prevalences over there, point prevalence that we can discuss again. So a number of current cases, one mean like basically mean number of person exposed to risk in this period, multiplier will be 1,000. Like basically prevalence is, although it is referred as rate, prevalence rate is really it is a ratio. Like it is of two type, point prevalence and period prevalence. Point prevalence is made for is specific for age or sex can be taken, and period prevalence is specific for duration will be taken. Like in malaria, there is annual parasitic counts also there, so that is the annual. So uses of incidence rate or population is different, and in the category of incidence. So so as of now we have covered this much only. In the next slide we will cover that methodology of which is undercoming for this is specific, we will cover in the next slide. So thank you.